Right, let's also get a medical perspective. Dr. Rajib Das Gupta joins us. He's a member of the National AEFI committee. Thank you so much for speaking to us, Dr. Das Gupta. How do you assess India's COVID preparedness so far? Are we on the right track in terms of the precautions now being taken, even though, as of now, there's no surge in India just as yet?
Thank you. Yes, the preparedness is certainly on the right track. And that's equally true at the central level, at the state level, and down to the district and city level. The surveillance also has been geared up, as all your ground reports showed. There is certainly no surge, and the surge to watch out for is not so much the number of cases in specific, but what's happening to hospitalizations. The reason that's important is because this is the Omicron subvariants that we are dealing with, where hospitalization is actually much less than the picture we have seen with Alpha and Delta waves. Therefore, if hospital admissions or complicated cases are going up, that is really the worrying signal to look out for. So far, I would believe that the preparation is on the right track, and we do not have any evidence of the surge at present.
Okay, Dr. Das Gupta, please stay with us. Let's also get our colleague, Akanksha Khajuria in. Akanksha, you've of course been tracking the developments in terms of our preparedness very closely. Tell us about the plans being put in place by the Health Ministry as well as the states in the build-up to the mock drill tomorrow.
Well, absolutely. Tomorrow is going to be a very important day. A nationwide mock drill will be conducted all over the country as per the Health Ministry. During the mock drill, the focus will be on the availability of health facility, bed capacity, optimal availability of human resources, including doctors, nurses, availability of basic life support, testing capacity and medical oxygen. Other than that, the pharmacy in the hospitals will also be checked to ensure that there is enough medicine there. So to check all this and to make sure that India is prepared in case the health system gets overwhelmed and in case the situation goes out of hand, the India is prepared. And to make sure that happens, a nationwide mock drill will be conducted tomorrow. In fact, the Union Health Minister Mansukh Mandavia will also be visiting a government hospital here in the national capital. Other than that, he has also directed the state health ministers to go to the government hospitals in their respective states. So all this is being done keeping in mind that the situation does not go out of hand. And in the last 1 week, we've been witnessing meetings after meetings by the central government. Today also there's one such meeting which is happening right now, which is between the Union Health Minister and the Indian Medical Association. In the last 1 week, we also saw the Prime Minister conducting a review meeting with the top union ministers, and also a Health Minister conducting a review meeting with the top health experts of the country. Right now, in the last 24 hours, India has witnessed 192 cases. The situation is normal, but the central government is maintaining that people should remain vigilant, they should remain cautious, maintain social distancing, wear masks, and keeping all of this in mind. Tomorrow is going to be very crucial.
This is before the mock drill tomorrow. Thanks for filling us in with that, Akanksha. Dr. Das Gupta, coming back to you, you've also been keeping a very close eye on the international situation. And to cite what you've just written, sir, a couple of days ago, you've said that there's been a 27% rise in cases in the Americas. At the country level, the US registered a 50% weekly increase. Japan and the Republic of Korea, 13% each. So we might be faring better, but how do we keep this momentum and ensure that things do not go awry?
Yes, the situation in different countries is, of course, quite different. In India, we believe that, and this is something that's been talked of pretty widely, of a combination of a high level of natural infection all through these months, plus a very good vaccination coverage. That's what has served us well, and particularly in this Omicron subvariant times. Of course, having said that, the whole purpose of the governments and the administrations are to keep the vigil high. And given the fact that the virus is circulating certainly in some of these countries and air travel is absolutely at normal levels, India certainly does to keep its alert very high.
And Dr. Das Gupta, to quote what you've said, and this is a concern that's been echoed across people from the medical fraternity, that the lack of widespread uptake of booster doses remains a matter of concern for those individuals who may be vulnerable on account of age or other comorbidities. And this is something that's been cited where our booster coverage is only approximately 28 to 30%. That's still a worry.
Yes, of course, that's a worry, particularly for those who are vulnerable. But even otherwise, in a population which has some immunity gaps, new variants emerge, and that really is the worry of the international experts in the China context. One, of course, is the suffering and the high number of cases and mortality there, as is being reported pretty widely. But there's this additional worry that if the population is under-immunized or there's the coverage is in patches within the population, then the possibility of new variants emerging is also very high. So on both these counts, both for personal protection as well as at the population level, it's imperative that those of us who are eligible, complete the boosters. The government also has been making efforts for that. The nasal vaccine has been approved, and all of these should add to the impetus. And I hope more and more will be taking the booster dose who are still due for it.
And Dr. Das Gupta, there was one statistic that one came across recently that is also a cause of concern, and that is that approximately 75 million people belonging to the eligible population for vaccinations have not yet taken their second dose. Now, in a country like India, where absolute numbers are also very high all the time, this is something that also needs to be addressed on priority.
Yes, I can't agree more with you on that, and that's also a disturbing statistic, if I may, and the fact that many are still outside the cover of the first and second doses ought to be a matter of worry. But really, if a surge, we begin to see a surge, then these are the people who currently have a very low probability of infection, of course, but they may end up with serious disease, and some of that we are actually witnessing in China.
Since you brought up the question of China, Dr. Das Gupta, clearly the zero COVID policy appears to have been counterproductive there. So therefore, any surge at all that's been witnessed in different parts of the world, Japan and the United States and other countries, how would you track how they're actually approaching this surge vis-a-vis what we're actually witnessing in China? How has their approach been different? Because they don't appear to have followed a policy of extremely stringent lockdowns.
Yes, you're absolutely right. But what we must also remember is that the testing rates are quite different across countries, one. Okay. Second, different countries have done differently in terms of vaccination coverage. Of course, the respiratory infections are pretty high in the temperate zones also. So everything taken together, countries, so some of the regions are reporting high cases, despite, as you very rightly say, yes, the not following a zero COVID policy, which is the specific case for China.
Many thanks for joining us on this broadcast and sharing those opinions with us, Dr. Das Gupta. We'll, of course, turn our focus now to what's been happening